welcome to 3 Talk with me, Noeleen. The changes we've seen in our socio-economic environment has resulted in our diets changing from healthy, home-cooked, nutritious meals to fast, microwave, over-processed foods that are wreaking havoc on our digestive system and health in general. This results in diseases like heart failure, hypertension, and diabetes. The Heart of Soweto Project is an initiative that seeks to educate people about what the effects of an unhealthy, cholesterol-filled diet are. The project also helps patients with heart-related illnesses live healthier lives through disease management, cooking demonstrations held at the Chris Hani Baragwanath Hospital in Soweto. We're not live today, so unfortunately, I won't be able to take your calls. Joining me in studio to talk about the Heart of Soweto Project is the director of the Soweto Cardiovascular Research Unit at the Wits Department of Cardiology, based at the Chris Hani Baragwanath Hospital, Professor Karen Sluwer, as well as, and always on a Medical Monday, I'm also joined by 3 Talks regular medical expert, Professor Harry Seftel. Professors, welcome. Thank you so much for joining us. Let's start with you, Prof. What is the Heart of Soweto Project? How did it come about?
The Heart of Soweto Project started and is still an ongoing research project, which was initiated 2005. And the purpose of the project was to explore what kind of diseases we're actually seeing in Soweto, in South Africa, and later on also in other countries.
Yeah.
And it started as it's a collaboration with the University of Queensland and the Baker Research Institute in Melbourne, where we developed a data capturing system. So everyone who came to the cardiac clinic from 2006 to 2008, and these are now more than 6,000 people, were entered into a very large database evaluating what kind of cardiovascular diseases are seen in the cardiac clinic. And remembering that Baragwanath Hospital is the only tertiary hospital serving the community of Soweto with about 1.1 million, it gives quite a good systematic approach to the type of problems we are dealing with.
And what are the kind of problems that you're dealing with?
What our data has found is that seeing the diseases which Professor Heart of Soweto has also observed in the 60s and 70s, the diseases of poverty, which are rheumatic heart disease, weak heart muscles, tuberculosis affecting the heart muscle. So that's about half of the cases. But now we have this new, what we call the sort of new diseases of lifestyle, which is hypertension, diabetes, based on obesity, wrong food choices, that are markedly increases. So we have what we call a double burden. The diseases for poverty, but the diseases of the wrong lifestyle in a similar degree.
And have you found that in the kind of the 80s, the 90s, the 20s, 2009, 2010, that people's lifestyle choices have actually become worse than when Prof. Seftel was at Chris Hani Baragwanath Hospital like 50 years ago?
Yes. What we have found, our data shows that actually almost half of the patients who come to Baragwanath Hospital live in Soweto shorter than 5 years. There are many people who come in for work. They come from Eastern Cape, from all sorts of reasons. And moving from a rural area to an urban area has a vast effect on our way we are living. It has an effect on the amount of sleep we are getting. And people in urban areas sleep less. People don't have time to prepare a healthy meal. They often go to certain shops to buy pre-cooked meal, which is what Sandra will tell you in a few moments, much more fatty. So it has an effect.
And Sandra is the dietitian involved in the Heart of Soweto Project.
So our food in general, and that was observed in other urban areas around the world. When you move from a rural lifestyle to an urban lifestyle, you change, the type of food you are eating is changing. And also in Soweto, many women are working. And that means they don't have the time to spend what they used to do preparing a healthy meal.
Now, you've been, working at Chris Bar, or used to work at Chris Hani Baragwanath Hospital many years ago. But what have your observations been?
Well, everybody knows that heart disease is the commonest cause of death. Would we agree, Carl?
Yes.
But I think we must also emphasize that it is, in a real sense, Noeleen, also perhaps the most preventable. You see, as Karen has indicated to you. See, in my time, 40, 50 years ago, I'm young but not so young. The major problems, if I can just go through them, they're not many. Although in the textbooks here there are over 100 kinds of heart disease, the actually important heart diseases are few in number. So what we had, as Karen indicates, we had a condition where the heart muscle was weak and they were in heart failure. We used to call that a fancy word called cardiomyopathy. So as I'm talking, I wonder if I can just ask Karen just quickly to indicate what the situation is now. You see? I'll tell you about what we had then, 40, 50 years ago. How much heart muscle disease do you see today?
We see actually a large number. I don't think it got less. We just have more from everything.
And what we used to see then, well, the causes, I say, we weren't quite clear. I don't know what we feel today. But a very important thing that we had in those days were migrant laborers living in hostels, men, doing hard manual work, eating very badly, and drinking a lot. And so they had a sickness called beriberi, called wet beriberi. Do you still see that?
No.
Again, it's a type of heart failure. Now, that's disappeared. So that's a change for the better.
Yes,
that's a change for the better. Then we said we had, for example, infections. The commonest problem was rheumatic fever, which is due to a strep infection, say, of the throat. Okay? And it was a major problem, especially in young people, in children and in young adults. How much do you see at the moment of rheumatic heart disease?
We don't see the acute phase because most children in Soweto have access to primary health clinics. They get their antibiotics for their tonsillitis. But we still see a large number of people who had rheumatic heart disease 10, 20 years ago, and now they're in their 30s and 40s, and their heart valves are giving up, and they come with heart failure. We see still a very large number of those, about at least 15, 20 a week, which is a large number.
Which is quite a large number. Who are you trying to help with this project?
We try, first I mean, I am a director of research unit, so one of my main goals is obviously to provide information, and the information is used by the Department of Health, by the World Health Organization, and by other agencies, because if you don't know what kind of diseases you see, you can't plan healthcare. So that's the one big goal of my work. The other one is obviously to translate what we found out into change in behavior. And because we have still an increased number of the diseases of lifestyle. We have an increased number of obesity, of hypertension, leading to stroke, leading to heart attacks. But now it's the right time that people learn about it and can change their life.
Now, you're talking about obesity, and I see you've got a chart here. Both of you, what does this chart mean?
It's basically body mass, and it's your relationship of your height to your weight. And if you have a normal body mass index is between 18 and 24.
Okay. I see you've excluded me in that. Thanks, Prof.
And
apologize.
Overweight is from 25 to about 30. Obese is when you are from 30 to 35. Then we have a category called severely obese, which is up to 39, and morbid obesity, which is above 40. And your risk of developing a heart attack or stroke is increasing from here to here. So if you are very, very obese, you have a multifold increase. You have a higher chance to develop hypertension, stroke, and diabetes.
And Noeleen, can I just mention then and now? 40, 50 years ago, heart attack, what we now call coronary artery disease, coronary heart disease, was very uncommon in a hospital like Baragwanath. I used to see perhaps one a year. Today,
we see about 200 a year.
200 a year. You see,
so
as a result of the lifestyle changes that you've mentioned, absolutely. The obesity, the hypertension, the diabetes, and smoking. That was another heart disease we had, called smoker's heart. People who smoked got chronic bronchitis and emphysema and got what we call failure of the right side of the heart. You still see that?
You still see a lot of that. But the biggest problem what we see now is not yet the heart attacks. Heart attacks take a while to develop. But we see a half of the patients we are seeing at Baragwanath Soweto and also at the local clinics is actually people with severe hypertension. So the blood pressure is high, and because a high blood pressure you don't feel, you don't know about it. And
the silent killer, we call it.
We call it the silent killer because you walk around for a year with a very high blood pressure and you suddenly get a stroke. A stroke is when half of your body suddenly doesn't move, or you die immediately, or you later get a heart attack. So I think we will see many more heart attacks later, but at the moment we find this people with very high blood pressure who don't know about it.
And that's very dangerous.
And that's very dangerous.
Well, Profs, we're going to leave it there for now, but I'm going to bring you back a little later on, and thanks for joining us. After the break, 3 patients who suffer from heart disease and diabetes tell us how the project has helped them lead a healthier life. More after the break.
Imagine a world where all South Africans have access to quality medicine at affordable prices. A world where affordable healthcare is a right, not a luxury. That's been our mission since the beginning. Welcome to the world of Cipla Pharmaceuticals. Whether it is constantly extending our product range or consistently introducing innovation, our mission is always to make the life of the patient better. Today, across 183 countries, there are millions of people who benefit from a Cipla product. In their cure and relief lies the ultimate purpose of what we do. We believe there is no point in developing life-saving medicines if you cannot make them affordable for the patient. Ask your doctor or pharmacist for the Cipla medicine. Cipla, we'll make it better.
You're back on 3 Talk, and today we're talking about the Heart of Soweto Project. Please welcome Anna Ngwenya and Catherine Khadebe, both of whom were diagnosed with heart problems, as well as Cynthia Gwaza, who was diagnosed with diabetes. Bome, thank you so much for joining us. When did you first hear about the Heart of Soweto Project?
2003.
Yeah. Is this before you were diagnosed with a heart problem?
I was diagnosed already.
Yes.
So I went to see the doctors at Bara, and then they told me there's nothing we can do with your heart.
Yeah.
It's a heart failure.
Yeah.
So I started attending those classes, cooking classes. That's where it started now, to see my life at least becoming better.
Yeah.
Because before I was just eating roughly.
Yeah.
I could eat the whole day, butter, everything I cook, I put oil.
Yeah.
So, but after attending the cooking classes at Bara, I became better. I'm a person today.
Yeah.
I couldn't walk a distance without short breath. I couldn't sleep. I'm sleeping with 3 pillows.
Yeah.
So after attending
the cooking classes, the Heart of Soweto cooking class.
Everything changed. My life changed altogether.
Yeah.
So today, even in the grocery shops, I know what to buy today.
Yeah.
Before, I didn't know. I just took any label I wanted. Say, like, maybe I wanted oil. I just took oil.
Yeah.
I didn't look cholesterol-free or what.
Yeah, yeah.
But today, this classes made me wise.
Yeah. Now, has it affected, I will come back and talk about how it's affected your family as well. Catherine, you've also been diagnosed with heart problems. When were you diagnosed with heart problems?
In 2008.
Yeah.
When I was getting birth. So when I go to the hospital to get my baby, they found out I diagnosed with heart problem. So they take me to
Heart of Soweto Project.
Project. So they attended me, the nurses and a professor. They helped me a lot. Even Sandra, it teaches us how to cook, how to eat. I used to eat fish and chips during the day, anything I wanted to eat. But by Heart of Soweto, it's a disgrace. It's amazing. It's amazing. It's a lot. It helps me a lot because even now I can walk. I exercise. I do anything I want to.
Did you exercise? Do you exercise,
Yes, I do a lot.
Yeah. So these are some of the things. Now,